It's been
Good morning,
just over
everyone.
a year since the first major flight we organized to bring Canadians home from overseas. When we were coordinating emergency repatriations last winter, our priority was doing whatever it took to keep people safe. And from that moment right through to today, that continues to be what we're focused on. From border measures to vaccines to rapid testing to the wage subsidy, we're using every tool in the toolbox to get us all through this crisis. Let me start with some news on border measures. As of February 15th, when you return to Canada through a land border, you'll need to show a 72-hour PCR test, just like for air travel.
Next Monday, February 15th, when you return to Canada through a land border, you'll need to show a 72-hour PCR test, just like air travel.
Today, I also have some news to share on vaccines. This week, tens of thousands of Pfizer vaccine doses will be delivered to Canada. This is good news for so many people who will be getting their dose. We know we all want to feel that relief of getting vaccinated, of watching our loved ones get vaccinated. We're all eager to know when it's going to be our turn. Well, I can tell you we are still very much on track for tens of millions of doses into the spring, and for everyone who wants to be vaccinated by September. Moving forward in the coming weeks and months, we're going to get even more doses, even faster, so we can all move through this together. Next week marks the start of a major ramp-up in vaccine shipments. Starting on the 15th, we're expecting hundreds of thousands more doses each week, and that's just from Pfizer. There are also other vaccine candidates currently in the approval process, and the top experts at Health Canada are working around the clock to ensure that any of these new vaccines approved is both safe and effective.
We have already administered more than 1 million vaccines to fight COVID-19 in Canada. These essential doses were administered to your parents in long-term care centres, to your friend who is a nurse, or to your neighbour who is a personal support worker. And this is just the beginning. We will continue these efforts until every Canadian who wants to will receive a vaccination. This week, tens of thousands of additional Pfizer doses are arriving, and several other million are coming. With respect to the vaccinations, things are on track despite some temporary delays. We will be receiving 20 million doses from Pfizer and Moderna over the spring. Other vaccine candidates are being approved. Health Canada experts are working very hard, and you can be sure that every vaccine will be approved, that is approved, will be safe and effective. I can reassure you that you and your family will be vaccinated by September. But even though everything is on track when it comes to vaccinations delivered to Canadians, we're not yet out of the woods. By keeping your distances, by washing your hands and wearing the mask, you can continue contributing to the efforts to fight COVID-19. We cannot ease up.
This morning, I also want to talk about where we are with testing. Rapid testing is key to keeping this virus under control, especially in schools, long-term care homes, and workplaces. Last Friday, this is something I spoke about with Dr. Janine McCready in Toronto. She and her team have spearheaded an innovative testing program at several schools, getting tests directly to communities that need it. In some neighborhoods, she told me that as many as 1 in 5 tests, that's 20%, come back positive. Clearly, there's real need for this testing. Her work shows that when people can get screened for COVID-19 and then get their results quickly, we can stop the spread. And this is true right across the country. Here in Ottawa, a recent program to test asymptomatic students and their families found several positive cases. Since they weren't showing any symptoms, without testing, these kids would have been in a busy classroom. But because of ramped up testing, their families knew to isolate at home instead. Testing widely and often reduces transmission. That keeps cases down and it keeps people safe. Our government has sent 19.6 million rapid tests to the provinces and territories, with more on the way. We all want to see cases go down. We know that these tests can make a difference. Tests must be deployed. They can't be allowed to expire. And testing, like more contact tracing and vaccines, are going to be an essential part of the months forward as we get past this virus and this pandemic as quickly as possible. We all need to keep working together on all these different aspects to make sure we get through this summer in right form.
In addition to talking about the need to use rapid testing during our regular meetings with premiers, we're now working with the private sector to deploy these tests in the workplace throughout the country. Testing is effective, and we want to ensure that the rapid tests are used. These essential tools will help us get through the months of winter and go into the spring mass vaccination period in the best condition possible.
As Canadians, we all look forward to spring, this year more than ever. But I know we can all agree that there's one part of the season nobody likes: tax filing. Even so, it's important to file your taxes so you get things like the Canada Child Benefit, the Work From Home deduction, and the Climate Action Incentive. These benefits and credits can really help, especially after such a tough year. So that's what you should be able to focus on. Right now, I don't want you to have to worry about what you may owe in taxes. That's why we're providing 1 year without interest on certain 2020 tax debt, giving people more flexibility to repay amounts owing from last year. If you received federal emergency benefits, like the CERB, and you made up to $75,000 in taxable income, you will not have to pay interest on 2020 tax debt until April of next year. Our priority is ensuring that you and your family get through this pandemic and back on your feet.
This past year has been quite difficult for those who have lost their jobs or those who have had their hours reduced. We want you to get back on your feet without having to worry about the tax you need to pay. Last year, more than 8 million people applied for the CERB to pay for their rent and put food on the table. I know that some individuals have pointed out some inaccuracies in the information pertaining to the net and gross income requirements to get the CERB, but we're going to clarify the question. People who applied for the benefit based on their gross income rather than on their net income will not have to return the payments that were paid to them, providing that their application also respects the other eligibility criteria.
For people who accessed CERB based on their gross income instead of their net income, as long as you meet the other eligibility criteria, you will not have to return those CERB payments. When we rolled out CERB last March, it was because people needed help in the face of a global, once-in-a-generation crisis. Well, the pandemic isn't yet over, so neither is our support. If you need help while you look for work, the Canada Recovery Benefit and Enhanced EI are there for you. If you need to take time off to care for your family, look to the Canada Recovery Caregiver Benefit. If you need to stay home from work because you're sick, the Canada Recovery Sickness Benefit is there to help. And if you need support on payroll for your employees or costs for your businesses, the wage subsidy and business loans are made for you. It's not easy to run a business from home or adapt to new public health rules. Yesterday, I spoke with Karen and Fahie. They're two young Black entrepreneurs who have big plans. Karen showed me her photography studio and talked about the great work she's doing supporting Black-owned businesses and products, and her excitement about moving forward to a bricks and mortar storefront as we move through this pandemic. Right now, she's all online. And Faye talked to me about the costs of shipping coffee across the country and his excitement about building his business and also moving towards opening a coffee shop once we get through this pandemic as well. They all have big plans. And for all the young entrepreneurs across the country, all the entrepreneurs who are looking to go digital, to change their way of doing things, to grow through this pandemic and beyond, know that we are there to help you get through the hurdles and barriers in your way and create success, not just for you, but for employees, for community, and for our whole economy. We're here to support Canadian business owners, from training on e-commerce to targeted initiatives like the Black Entrepreneurship Program and the Women Entrepreneurship Strategy. Because no matter who you are, an entrepreneur, a worker, a parent, we've got your back.
This pandemic is not easy for anyone. Moreover, winter can make this all seem more difficult. During February, sometimes we have the impression that spring will never come. It's normal. It's understandable that we not feel that we're in top shape. But don't forget, we do have resources to help you. And moreover, this Thursday, this is the National 211 Day, which reminds us that everyone has access to a confidential distress line, toll-free by dialing 211. Whether you need help for mental health or if you need information about community services, don't hesitate to dial the number. The service is provided 24 hours every day in 150 languages. The agents at the other end of the line will help you find the proper resources. You're not alone. So please, ask for help. Take care of yourself.
Before I close, I'd like to take a moment to recognize a great public servant, Ian Shugart, the clerk of the Privy Council. Ian has been an extraordinary leader through this public health crisis. He's leading the public service in tremendous efforts and supports to get Canadians through this pandemic. And as he faces health challenges, I want him to know that we're all pulling for him. Merci beaucoup tout le monde.
Thank you, everyone.
Thank you, Prime Minister. Starting with the phone today. Opératrice, une question, une sous-question. C'est à vous.
Thank you. The first question, Althea Raj, HuffPost Canada. Your line is open.
Good morning, Prime Minister. Your government has responded to several whistleblowers who broke the law by leaking information to the public about what was happening in places such as Rideau Hall and in some long-term care homes. I don't think most Canadians realize that the whistleblowing law actually prevents whistleblowers from speaking publicly, that if they talk to journalists to flag wrongdoing, they can be fired for doing that, and that that is legal. 4 years ago, your own government, your own MPs rather, told your government that the law needed fixing and that it should be expanded to encourage more workers to come forward and flag wrongdoing so that corrective steps could be taken. Although you promised to do something, nothing was done. Now that you've spent hundreds of billions of dollars and more than 20,000 Canadians have died, will you expand the whistleblowing law in order to protect and flag whistleblowers and to flag wrongdoing?
It's extremely important that every Canadian has a safe and secure workplace, free from harassment or other challenges and inappropriate behavior. That's why we've taken significant measures to strengthen processes and procedures in supporting anyone who comes forward with concerns. We also know that whistleblowers play an extremely important role in flagging how government can do better. And indeed, the level of transparency and confidence a government can give Canadians in constantly improving, constantly doing better and sharing what we need to do to improve is something that we've always been committed to. I look forward to continuing to work with all parties and members of the public service on strengthening measures to make sure that this government is always open about what's going wrong and how we can fix it.
Following up, Althea?
Yeah, I feel like you constantly say the right things, but your government's actions don't follow through on the words that you say. Why won't you fix the law if you acknowledge that it is too restrictive?
We're always looking to do better. We're always looking to improve structures and systems within the government. And I thank you very much for bringing forward these concerns. Like we have many MPs and Canadians bringing forward these concerns. We're going to continually look to improve structures to make sure that what we're doing for Canadians is being done right, is supporting Canadians throughout this pandemic and beyond. I made a simple promise at the beginning of this pandemic that we would have Canadians' backs. And through listening to MPs, to Canadians who come forward with gaps or challenges that they're facing, we've done a tremendous amount to improve the supports for Canadians right across the country, and we will always look to continue to do that.
Thank you. Opératrice, prochaine question au téléphone.
Merci. La prochaine question, Catherine Lévesque, la presse canadienne.
Question, Presse Canadienne.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to go back to the issue of land borders. Will Canada refuse to let snowbirds to re-enter the country if they don't have a test? No. Answer, no. It's not legal for Canada to refuse entrance into Canada from someone who has the right to enter, who is a Canadian citizen. When they come to the border in Canada, they are already on Canadian territory. We cannot send them back to the United States if they are Canadian or if they are permanent residents. However, we can apply severe penalties if they don't have the test. We can require extensive follow-up by Health Canada, but the vast majority of people are going to do what is needed, get a test when they get to the border, and so that they can go to their return home for their quarantine period.
It is not legal to refuse entry to any Canadian who wants to come home. And that's something that is the major difference between land borders and air borders. You can prevent someone from boarding a flight in Miami or elsewhere. You can't prevent someone who's standing at a land border crossing from entering Canada because technically they're already on Canadian soil when they're speaking to that customs officer. That's why what we can do is, in cases of no test to show, apply a stiff penalty, a fine, and demand and ensure a rapid and complete follow-up to make sure that they are getting tested, that they are being properly quarantined, that they are not putting at risk the safety of other Canadians by returning home without a clear negative test. These are measures we're putting forward, but as of next Monday, people who show up at a Canadian land border on non-essential travel will be expected, like returning snowbirds, will be expected to show a negative PCR test from the previous 72 hours.
En suivi, Catherine?
Follow-up question.
Oui, tout à fait. Pouvez-vous nous dire de
Can you tell us what type of penalty or fine will be applied? What will be the consequences for a Canadian who does not have a mandatory test? Thank you. First of all, we need to understand that non-essential workers who take the plane represent about 15% of travelers who are coming back into Canada by plane, but the non-essential workers through our land borders represent about 5% of the people. The vast majority of people who cross our land borders are essential workers, truck drivers, nurses, those types of people. So for this small proportion of people who do go through our land borders, if they don't have a negative test, there will be fines that will go up to $3,000 per person. There will be measures that we are going to be implementing to ensure that there is follow-up on these people, to ensure that they are not putting other Canadians at risk by coming back to Canada.
Opératrice, dernière question au téléphone.
Thank you. Merci. Our last question, Hélène Buzetti, Le Devoir.
Le Devoir, question. Good morning, Mr. Trudeau. You said that we could be dealing with fines up to $3,000 per person. Do you think that these travelers will be put into supervised hotels? And why don't we have any dates set? When people come to an airport when they arrive back here in Canada from overseas or abroad, if they show that they don't have an adequate quarantine plan, we already have locations where they can go and self-isolate if they cannot do their quarantining at home. We already do have systems in the major airports to look at these possibilities. Obviously, we're going to be working to ensure that these mechanisms for our land borders apply as well. We will be announcing further measures at one point, but I would wanted to give people advance notice, telling them that as of next Sunday, if you cross a land border and you're going to have to show that you have a negative PC test. As for the other measures, and including the measures in the airports, we will be making further announcements in the next few days. We are ensuring that Canadians are going to be well protected. Follow-up question. Going back to this CERB issue and the fact that people don't have to reimburse, a lot of people said that right at the outset they didn't apply for the CERB because they had understood the rules correctly. They did understand about the gross and net income requirements. Do you feel that these people are going to be treated unfairly, in fact, that they didn't apply for a CERB? There will be no retroactive measures. We're here to help people who made a mistake because of a lack of clear instructions. We don't want to compel them to reimburse, and we have introduced a wide range of benefits to help people out, but our eligibility criteria were set for those specific reasons.
Michael Lanchfield, Canadian Press. I want to ask about, get some thoughts on vaccine nationalism from you, that concept. The U.S. has invoked its Emergency Defense Act. Europe is reportedly putting some strict controls over the export of certain vaccine ingredients. This obviously has implications for Canada and our supply. I mean, how can these actions not have a negative impact on the flow of vaccines to Canada? What can you say to Canadians who might be wondering about this?
We worked very hard from the very beginning of this pandemic to secure a diverse portfolio of vaccines for Canadians because we knew there would be challenges. We saw challenges in the spring around PPE and the competition internationally for that, we would be well advised to ensure both a diversity of origins and sources and types of potential vaccines, as well as sufficient doses to ensure that we would be able to cover all Canadians in various different configurations, depending on which companies landed effective vaccines first. Obviously, we continue to work with partners around the world. We understand the pressure that every government is feeling to vaccine as many of their citizens as quickly as possible. We're certainly working every single day and night, to make sure we're getting as many doses for Canadians as possible, and we'll continue to. And indeed, we're going to see millions of doses arriving in the coming weeks and tens of millions in the coming months. At the same time, we all know that we don't get through this pandemic anywhere until we get through it everywhere. It is a global pandemic, and that's why Canada, while at the same time as we are procuring vaccines for Canadians in a priority way, we are also participating fully in initiatives like COVAX and other international initiatives to ensure that we are supporting the developing world who need access to vaccines as well.
Glenn McGregor, CTV News. Prime Minister, Toronto's top public health officer has said we're entering a new pandemic now because of the emergence in the province of variants from South Africa, Brazil, and the UK. And yet the Premier is moving ahead with economic reopening, starting even this week. Asking you not as a Prime Minister, but as a resident of Ontario who sends his kids to school here, are you comfortable with that decision to begin reopening now when we're still facing all these variants and potentially a third wave?
I think we're all worried about the arrival of new variants and the impact that that could have, even as we are working hard to get everyone vaccinated as quickly as possible. There are real questions about what the impacts these variants will have both on the spread of COVID-19 and on the impact of the vaccines. That's why while we work on vaccinating people as quickly as possible, we also need to add to that public health measures, which means restrictions in many cases, but also means things like contact tracing, means things like using the app and expanding it to use QR codes, moving forward on rapid testing very efficiently so that wherever we see outbreaks, we're able to isolate those and respond quickly. We're going to need to be extremely nimble as we move forward on a reality of new variants that's going to require all of us to continue working together, to continue working to get vaccines in as quickly as possible, but also making sure we're keeping up to date on the testing, the contact tracing, and everything each of us individually can do to keep ourselves and our loved ones safe.
Steve Chase with the Globe and Mail. I have a question about the reporting we did about this company, which is operates the Visa Application Center for Canada in Beijing. It's actually owned by the Beijing Police, the Public Security Bureau. Now, this Public Security Bureau, of course, has quite a reputation. It's been accused of torture by human rights critics. But more importantly, what will you do about this? Will you allow this to continue? And what would you tell Chinese nationals seeking to escape China about the safety of applying for a Canadian visa at a visa application center run by the Beijing Police?
First of all, we take the security of all applicants and the privacy of all applicants extremely seriously. And when we contracted out with a global company that does visa services around the world, we ensure that it is able to keep Canadians and applicants' data private and secure. Indeed, when they further subcontract to local offices and local companies, that is something that we continue to demand. But in the case of this particular local office, I can tell you that a number of other countries also use this local company, including Great Britain and New Zealand, who are both our Five Eyes companies, Five Eyes allies. We of course, take these reports extremely seriously, and I've asked the ministers involved to follow up and ensure that we can guarantee the safety and integrity of our visa systems for all applicants.
Hi, Prime Minister. Tom Perry, CBC. We've heard some reports out of Calgary about travelers being kept in quarantine hotels, not getting enough food, being denied medical access. I'm wondering what you think about that. Are you worried that these kind of reports feed into conspiracy theories about government internment camps, things like that? And also, how do you ensure Canadians, as you move to set up this 3-day quarantine, that they're not going to be essentially held in prison?
I think it's extremely important to make a clear distinction that these aren't detentions. These are medically based isolations. On the 3-day quarantine, for example, that is the average time for a PCR test to be returned. It's the expected amount of time in which a returning traveler might have to stay in the approved local airport hotel. But indeed, if it only takes 24 hours to get that PCR test back and it comes back negative, they are going to be free to go home and continue their quarantine as mandated at home. We are not detaining people. These are public health measures that are necessary to ensure that we are keeping Canadians safe, particularly given the arrival of new variants in Canada and extensively around the world. We need to do everything we need to keep people safe. We need to do that in a way that is respecting people's dignity and supporting them properly. And I can assure you that everyone is following up carefully to make sure that the conditions in which people have to do their quarantine or their testing are always adequate.
En français, s'il vous plaît, Monsieur Trudeau.
I think it's important to understand that the measures we have implemented, such as the 3-day wait period for test results, this is not a punition. Punishment. These people are not in detention. They have to isolate until they get test results. Normally, it takes about 3 days to get the results, but should the person receive results after 1 or 2 days, they're free to go back to their homes, to continue their quarantine with follow-up. But we're not there to detain people. We are there to ensure that the public health regulations are followed and that everyone is kept safely. I can assure you that Health Canada and the Public Health Agency of Canada view the need to treat everyone with dignity, and we will always provide follow-up to ensure that this is the case. Radio-Canada question. With respect to the CERB, you're going to give people more time to pay back these benefits, but this was emergency relief for people who were in need. Just by delaying this reimbursement, do you think that will help? Do you think we'd be better off just canceling it? For those who are the most vulnerable, the most in need, they won't have much taxes to pay anyway. The CERB was not put in place for people who were the most vulnerable. A lot of people applied for CERB, and they will have the means to pay taxes in the months that lie ahead. We are always worried about equity for everyone, and we want to take ability to pay into consideration. But a lot of people applied for CERB. That's understandable. Some people will be paying taxes on it. Same thing for employment insurance.
Obviously, we put forward measures to help people who are in difficult situations, and the CERB is there to help. Was there to help people who were facing no revenue coming in because of the pandemic, and that was extremely important at that moment. But the CERB wasn't only taken up by low-income Canadians. Obviously, if you're extremely low income and you took the CERB, you're unlikely to be having to pay much in the way of taxes come tax time. But for many people who took the CERB because they needed it in the moment, but then went on to get back to their job, back to work, and are in the income range where they're used to paying their fair share of taxes, the CERB will be taxed. It's about making sure that it's fair for everyone. We tax revenue, we tax income related to employment insurance, for example. The CERB is there as a income replacement measure. Some people will not have to pay taxes on it if their income is low enough. Many others will need to pay their share of taxes. That's just how our system works. But we are giving an amnesty on people on the interest payments on repaying their CERB taxes, because we know that we're still going on in this pandemic, and it's a tough time for everyone, and we want to be able to support people as best we can.
Prime Minister Michael Couture with Global National. On the allegations facing General Jonathan Vance, the Office of Defence Minister Harjit Sajjan says it notified the Privy Council office of concerns about Vance's alleged behavior. So first I wanted to know, is that enough? And Canadians want to know what you knew. Did Defence Minister Sajjan at any point raise concerns with you about General Vance's behavior towards female subordinates? And I think Canadians just want to know what you knew.
First of all, Canadians know that everyone, whether they're in the armed forces or working for the Canadian government or in any workplace across the country, deserves to be in a safe workplace free from harassment or in unacceptable actions. That is something that we take very, very seriously as a government, which is why we've brought in strengthened processes over the past number of years and have absolutely no tolerance for these sorts of behaviors. We have brought in place procedures that need to be followed and needed to be followed in these cases. And we are very pleased that there is going to be a review going on to ensure that every step of the way the right processes were followed. That's something that will be looked at right now, but I can assure you that we've always taken these very seriously and ensured that those proper steps are followed.
Thank you, Prime Minister. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.
Thank you, everyone. will be increasing. He also quickly informed us that starting Monday, February 15th, any traveler crossing the American border coming into Canada for non-essential reasons will have to show a negative PCR test before they can gain entrance into the country. He also pointed out the importance of using rapid testing that the provinces and territories received, and that the private sector is in the process of taking measures to improve the safety of Canadians.
Minister Qualtrough for opening remarks.
Bonjour tout le monde. Hello everyone. Je suis très heureuse de me joindre à vous aujourd'hui avec mes collègues.
I'm very happy to join you with my colleagues, Minister Leclos and Minister Leboitelier, for this important announcement. Since the first day of the pandemic, we have implemented historic income support measures to help Canadians get through this crisis.
Workers and their families pay for things like food and rent at a time when we were asking people to stay home and flatten the curve. For many Canadians, this meant difficult weeks and months where very little, if any, income was coming in. We made the CERB's eligibility criteria as broad and inclusive as possible so that workers who needed support could get it, especially for the self-employed where income takes different forms. As announced by the Prime Minister this morning, if you applied for the CERB based on your gross income of $5,000 instead of net pre-tax income, and you met all the other eligibility criteria, you will not have to return your CERB payments. This means that as long as someone's gross self-employment income was at least $5,000, they won't have to repay the CERB.
To reiterate in French, if someone applied for the CERB based on gross income of $5,000 instead of pre-tax net income, they will not have to reimburse their payments. Of course, they will have to meet all of the other eligibility criteria.
By taking these steps, we are giving certainty to self-employed individuals who applied in good faith for the CERB. As I've said before, we'll always have the backs of Canadians. Today, we're also announcing targeted interest relief for Canadians who are facing income tax debt for the 2020 tax year as a result of having received COVID-related benefits. This will give Canadians who file their 2020 income tax and benefit return more time and flexibility to repay amounts owing. It also means interest won't have to be paid on any outstanding income tax debt for the 2020 tax year until April 30th of 2022. To qualify for this relief, individuals must have had a total taxable income of $75,000 or less in 2020 and have received income support through any of the COVID-19 targeted income supports.
We have gone to great lengths to help workers get through this pandemic, and we will be there to help Canadians. I would now like to turn the floor over to Minister Boutellier. Good afternoon to everyone. I'd like to say hello to Minister Qualtrough, who is on the west coast of Canada. So the Gaspé and the Magdalen Islands say hello to you. And I'd also like to say hello to Minister Duclos. Our government is sensitive to the fact that Canadians are still feeling the financial impact of the pandemic, and I can assure you that we're here to help you get through these difficult times. To do this, our government has implemented an interest relief measure for certain Canadians who will have a tax debt for the 2020 tax year. After filing their income tax, the eligible people will not have to pay interest on unpaid debt for the 2020 tax year until April 30th, 2022. To be eligible for this targeted measure, a person who has earned taxable income of $75,000 or less in 2020 and have received at least one of the emergency benefits offered, that includes the CERB, the student emergency benefit, the Canada Recovery benefit, the Canada Recovery sickness benefits, the Canada Recovery caregiver benefit, benefit or any employment insurance benefits or measures offered by provincials. It is intended that this measure will provide some interest relief to approximately 4.5 million Canadians who have been affected by the pandemic. In addition, the parameters of the payment agreements have been amended in order to give more time and flexibility to Canadians to pay their debt based on their ability to pay. In addition, I'd like to note that the agency will automatically apply the interest relief measure for those individuals who meet the criteria. With this measure, Canadians can continue to respect their tax obligations without suffering from additional financial consequences. As Minister of National Revenue, I'm proud to see that the agency puts people first. Our government is determined to help Canadians deal with this pandemic. Thank you very much. Thank you, Ms. Boutillier. Dr. Tam, please give your remarks.
Bonjour à toutes et à tous.
Good afternoon, everyone.
108,120 cases of COVID-19 in Canada, including 20,835 deaths and 40,175 active cases across the country. Over the past week, there were, on average, over 103,000 tests completed daily across Canada, of which 3.7% were positive for COVID-19. And national daily case counts have been declining for several weeks. Over the past week, there were an average of just over 3,500 new cases reported daily, which is less than half the early January peak of over 8,100 daily cases. This is gratifying progress, knowing the sacrifices we have all been making. And we are now seeing the additional benefits in the steady decline of severe illness outcomes that is relieving some of the pressure on the health system and workforce. Over the past 7 days, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by 15% to just under 3,300, including 728 in critical care, and fatal cases have dropped by 20% to 100 deaths being reported each day. While declining case counts, hospitalizations, and deaths are reassuring, we must continue to be cautious. Over the past week, the total number of new virus variants detections has more than doubled. 7 provinces are now reporting variants detections. And the first detection of the P1 variant that was first found in Brazil has been reported by Ontario. Although it is normal for variants to emerge as viruses continuously evolve, these are considered variants of concern because they're known to spread more easily. There is also a possibility of reduced protection of current vaccines. This is why we need to maintain the strictest vigilance in our public health measures and individual practices. This will help to prevent these variants from re-accelerating the epidemic and making it much more difficult to control. With now more than 355 B117 variants, 25 B1351 variants, and 1 P1 variant reported in Canada, together with evidence of community spread in at least 3 provinces, and links to outbreak activity in long-term care homes and other congregate settings, including a workplace, the risk is very real. But for every dark cloud, there is a silver lining, and we have several advantage points to work from. First and foremost, we know what works to control this virus, whether new variant or old. And second, we have the benefit of foresight from other countries who have demonstrated the effectiveness of sustained and vigilant public health measures to control new variant spread. Our way forward is clear. Right now, our measures are working. This means doing everything that we've been doing, but giving it the best we can give at all times. This simple rule can help us limit the spread of more transmissible variants while vaccine programs get underway. Aim for the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible. Stopping the spread of COVID-19 is up to all of us. Thank you.
Bonjour à toutes et à tous. Il y a eu
Good afternoon, everyone. There have been many cases of COVID, 20,037 deaths, and 40,000 active cases throughout the country. Over the past week, over 130,000 tests were carried out daily in Canada. 3.7 proved to be positive to COVID-19. The daily rate of new cases on a national scale has been decreasing for several weeks now. During the last week, 3,500 new cases on average were reported daily, which represents less than half of the number of daily cases reported back in early January. So we are dealing with remarkable progress. We know about all the sacrifices that we've all made. Now we see that there are still some serious cases out there, but there is, in fact, less pressure being put on our healthcare system and its staff. Fewer than 3,000 people with COVID were treated daily in Canadian hospitals. So 7,028 were in intensive care, which represents a 15% decrease. And this is being reported, and on a daily rate, 25% fewer cases. The cases of hospitalizations and deaths is reassuring, but we must continue to pay attention. Over the past week, the total number of cases reported of new variants of the virus has more than doubled. 7 provinces have said that the variant is present, and Ontario said that it detected for the first time variant P1, which was detected in Brazil initially. Viruses continue to evolve, and it's understandable that variants do crop up here, but these variants are more transmissible. It is also possible that the current vaccine does provide may provide less protection. That's why we have to be vigilant, and we must apply our public health measures, and this will prevent these new variants from causing another upsurge in the pandemic, one which will be more difficult to control. Given the number of cases that have been reported in the new variants in Canada, that is 3,500 for the variants B17, 25 for B17, and 1 for P1, shows that there has been propagation in the community in at least 3 provinces, and there are links with outbreaks that are occurring in long-term care residences and in congregate settings, and including the workforce. So the risk is very real. But we have to look at the good side of things, because we can take advantage of some very positive points. First and foremost, we know how to deal with this virus. Whether we're talking about the old virus or the new variants, we also have the advantage of the experience gleaned by other countries that have shown the effectiveness of being vigilant on a daily basis in order to control the propagation of these new variants. The process is clear. Right now, our measures are working. We have to continue all that we're doing and to take action on a regular basis. These simple rules will help us prevent the spread of this more contagious virus as we continue with our vaccination programs. We have to have as little interaction as possible with as few people as possible at a wide distance from each other. It's up to us all to deal with this virus.
Thank you, Dr. Liu. We would now be pleased to answer any question.
Merci. Thank you. We will now move to questions on the phone. For 1 question, 1 follow-up each. Nous allons procéder aux questions au téléphone pour une question de suivi chacun. Opérateur, première question. Operator, first question.
Thank you. Merci. The first question is from, la première question est de Bill Curry de Globe and Mail. Please go ahead. À vous la parole.
Thanks for Minister Qualtrough regarding this CERB gross versus net announcement. I guess 3 very precise questions. Roughly how many people are affected by this situation? What's the fiscal cost of making this decision? And then lastly, what do you say to those people who didn't apply for CERB because they went with the net income definition and now they realize that they'd gone with the gross, they could have received thousands of dollars last year?
Well, thank you for those questions. Very specifically, this response today addresses a specific issue of unclear information that was provided by our government that Canadians then relied on, in particular self-employed Canadians. We will have a better clarity on the number of people who are impacted by this when people file their taxes. We have a sense of a possible range, but it's really difficult right now because so many people haven't filed their 2019 or 2020 taxes, and their eligibility and their gross income will be calculated based on that information. So it's a bit premature for me to say how many people, but we know that as a bigger number, we sent out 440,000 letters to people whose eligibility still needs to be confirmed. A subset of that amount are in this particular circumstance. In terms of the cost, again, it will depend on the number. And what I would say to people who didn't apply for the CERB is, I appreciate the frustration you may feel with this, but we are dealing here with a subset of the 9 million Canadians who applied for CERB who legitimately and honestly relied on misinformation we provided. And that's the problem we're solving here today.
As a follow-up?
No, I appreciate the 3 answers. That's great. Thanks.
Okay, thank you. Opérateur, prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzetti de Le Devoir. Please go
Question,
ahead.
Le Devoir. I'd like to piggyback on the question posed by my colleague, this question of fairness. I do understand that there was information that wasn't clear, but a lot of people thought that they had understood the rules correctly, and so they didn't apply. So why not enable those people to retroactively make an application? Thank you for your question. I would say that we came up with a solution that is fair and reasonable under the circumstances for those people who have been affected by the lack of clarity in the information that we provided to Canadians. In all honesty, we can't reopen the legislation. We decided to not apply this decision retroactively to all Canadians. Today's solution deals with that group of Canadians that really misconstrued the information that we provided. As a follow-up, I don't know if the minister can answer this question, but with respect to these border measures, these land border measures that were announced, so you may have a penalty, there was talk about follow-up. Can someone be a little bit more specific about what would be expected for these Canadians returning to Canada and getting their test results? Yes and no. I don't have all of the information that you are requesting, Ms. Buzetti. We are expecting that the vast majority of people who come to the border, land border, with a PCR test, that they will do so because we have announced 6 days ahead of time what the expectations were. These people who come to the land border without a test, as the Prime Minister said this morning, there will be a fine that they'll have to pay. The border security officers will be dealing with this, and the individuals will have to provide more precise information. As for follow-up, that is part of the police mandate. Minister Blair will be able to provide you with that type of information.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Hi, Dr. Tam. I'm wondering if you could talk a little bit more about the variants. You said that we know what to do to stop them. So that sounds to me like the existing measures we have in place should be enough to keep those variants from spreading. And we've seen some positive progress in the last few weeks, but we're also looking at provinces that are now lifting those restrictions that have maybe helped that progress along. Wondering if you're concerned about if lifting any of those restrictions, the lockdown measures, loosening those rules are going to have an impact on whether or not we continue this progress because of the variants or maybe even in spite of them.
Thank you for the question. And I think absolutely we've made good progress as we just went through in my remarks. But any loosening of these measures has to be done extremely cautiously because, as we all know, the population immunity level is not high. We're just beginning our vaccine programs. We've done many weeks of work in bringing down this epidemic curve, and the hospitalizations and deaths are beginning to come down. This is not the moment to really to sort of release everything that we've in terms of public health measures. I think province territories, of course, are making their individual decisions based on their own context, but all must do it with extreme cautiousness. And I believe some of them have plans to reapply public health measures very quickly, and if they see any changes. I think what my concern is that right now, if we release some of these measures, that a resurgence will occur, but that resurgence could be due to one of these variants, and then it will be much more difficult to control. So first of all, increase our testing and identification and sequencing and screening for these mutations is being escalated, but we need to do even better, I think, than what we're doing now. Provinces are screening more. Some provinces are aiming to screen every positive test for the variants, and that would be a good goal to aim for, increasing testing in the community. So it's, again, a balance of you can only ease things when you got the proper measures in place to rapidly detect and be able to implement public health measures again if needed. But I think, it is a concern. So when we said, right now, the simplest rule of thumb is still, restrict non-essential activities as much as possible. So aiming for that fewest interaction with the fewest number of people for the shortest time at the greatest distance possible is a very simplified way of looking at how we want to manage until the vaccine programs are well underway and that we learn more about these variants. But have you seen in Europe, if you look at England, Ireland, France, other countries, public health measures do work. So I think that is our sort of primary message. But yeah, do so with caution. If anything is going to be relaxed, then the proper measure for monitoring and response has to be in place.
Thank you for that. My follow-up question, I think maybe is for Minister Qualtrough. There are more people in the group who got those letters, the 440,000 letters, than are being referred to today in sort of getting a reprieve from having to pay it back. Are you considering further amnesty for any of those people? And if so, what?
Well, thank you for the question. Just to be clear, the letters were sent out proactively by CRA to people for whom they couldn't confirm eligibility. Many of these 440,000 people have now filed their taxes, have been deemed eligible, aren't in that list anymore. So it's not, let's not assume that all 440,000 will be ineligible, because we just can't. We just didn't have enough information. CRA didn't have enough information at the time to determine eligibility. And many Canadians have since filed their 2019 taxes, their 2020 taxes, and we've determined that they were eligible. If there's a specific subset of that you wish me to respond to, I can. But ineligible or eligible, we're going to work with Canadians to make this as seamless as possible for them. There's no requirement for people to repay now if they're deemed ineligible. We've announced today no interest on any tax you may have incurred as a result of being eligible for CERB. We're really trying hard to work with Canadians, relieve them of any stress or anxiety associated with our having helped them through the pandemic.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Christian Noël de Radio-Canada. Please go
Question,
ahead.
Radio-Canada.
Bonjour, messieurs, dames. Merci.
Good afternoon. Thank you for taking my call. I have a question on the tests of people who are coming back to the country and need to have a negative test showing they don't have COVID. If these people have already had COVID and if they have a test that shows that they're still positive, will they be exempted from the quarantine, or will they be treated differently? They're not necessarily contagious, even though if they at one point had COVID. Yes, that's an excellent question. And I'd like to invite my colleague, Dr. New, and Dr. Tam to answer. This is a process that we have been seeing in the airport. Thank you very much. I'll begin. Dr. Tam can add to that. Now the requirements for all travelers coming to Canada, they need to have a negative rapid test before they can arrive. But as you said, and as you pointed out, there are some individuals who have already had COVID-19. And so with the science and probative data that's still changing, we can see that those individuals who are now in good health and have already had COVID-19, after 10 days after the appearance of their symptoms, they're being viewed as being recovered and no longer contagious. So we're going to come up with a way to have some type of other certificate for those who have already had COVID-19 in the past, but this would be paramount to having a molecular test before arriving. Dr. Tam, did you want to add anything? We're going to consider those individuals who have recovered from COVID-19 as well. We could enable those people who show that they've had a test for COVID after the 10 days after the disappearance of symptoms, and within 90 days following the disease.
We will take that into account of people who've had COVID-19, who can demonstrate that they have passed the period of communicability, 10 days after they've got better. But because we do not know the duration of immunity at the moment, I think what we're thinking right now is 90 days since you've had the illness. You can still count that period, and that will be considered in lieu of a test, that pre-departure test.
Just to add to that, we do see that individuals who 10 days after disappearance of symptoms are viewed as being recovered and are no longer contagious. But there's this 90-day time period as well, because people may have had COVID-19. The 90 days have gone back, but they might be reinfected with COVID-19. So we have to consider all of those factors we're looking at science, which is changing, evolving constantly.
Merci beaucoup.
Thank you very much.
Ma prochaine question concerne
Follow-up question.
l'amnistie pour ceux qui ont fait
Amnesty for those who have made a mistake with regard to their net and gross income. My question is as follows. If we do have this amnesty for people who made a mistake in good faith, Ms. Qualtrough, you said you had an idea of the cost that this may represent without being too precise. There must be a maximum minimum cost. How much does the government evaluate that this will be in terms of unpaid revenue? Thank you for your question. As I said, we don't have an exact figure with respect to the number of people who benefited from this decision, who benefit from this decision today. It really depends on their tax filing. I'm sorry, I don't know how to say that quite in French. So it's difficult to determine how many people this applies to. So it'd be premature to put a precise figure on this. It really it depends on other factors as well, such as the eligibility, not only for the net and gross income, but for other factors. If you're not eligible for other reasons, if you shouldn't have got benefits, well, that's something that has to be considered. So I'm not comfortable to give you an exact figure without having exact information first.
Merci.
Thank you.
Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Karina Roman from CBC News. Please go ahead. À vous la parole.
Hi, yes, thank you. My first question is for Minister Qualtrough. You were quite clear repeatedly that the government was not considering giving this kind of amnesty to the CERB recipients who did it in error, saying there was no conversation happening about that. Can you give us a sense about why this about face? What's the impetus for the reversal of that?
Well, thank you. You're absolutely correct. In December, I said we'd made no policy decision to permit people who had applied based on their gross income at the time. We've dug in. We've heard from many Canadians who find themselves in difficult positions because of this honest understanding of their eligibility. We've took the time to come up with a solution that balances all of the complexities that you've been asking about today in terms of fairness and reasonableness. And we reached a conclusion that the fairest and most reasonable way to move forward on this would be to allow people who applied using gross to not have to repay their benefits.
Okay, thank you. My other question is for probably Dr. Tam. As cases of the COVID-19 variants, as they become more numerous in Canada, as they're rising in Canada, should we be testing all positive cases for those variants? And since we're not doing that currently, are we right now underestimating the prevalence of these more contagious mutations of the virus?
Yeah, so Canada is, compared to other countries, is testing a higher proportion of our lab positives right now for the variants. However, we can sort of accelerate that. There are two aspects to how we increase our capacity to detect the variants. One is what we call a screening test for the actual mutations, like the N501Y of interest. That does not require whole genome sequencing because that takes a while. So that kind of screening for mutations that are of interest is being undertaken in provinces right now. And as the numbers of cases come down in a number of provinces, they are aiming to screen all of their laboratory specimens for those mutations. So that capacity development is underway. And the whole genome sequencing, which can be done on a subset of these, that capacity is also being sort of accelerated. For example, the Public Health Agency's National Microbiology Lab, in conjunction with the Cancogen genomics sequencing initiative, in partnership with Genome Canada. So then you can also look at the whole genome on a subset of these. So I think we are accelerating right now, which is why I've been sort of saying that people need to be very cautious. These testing capacities are just accelerating. As you said, we might not know the full extent of the where these variants are in Canada at the moment. Provinces have done a huge amount of work when they find a variant case to be very diligent in contact tracing and looking at searching for cases and sequencing any cases around those. So that's another way of looking to see if these variants have spread. So I don't know if that answers your question, but it's true that we may not be detecting all of them for sure. And I think we may assume, for example, for the B117 variant, that there is a certain degree of community spread. The other variants, we're detecting less of them, but some of them, for example, some of the South African variant cases or the B1351 variant cases were not linked to travel. So that tells us that there's a degree of community spread, but that doesn't seem to be wide at the moment, but it's something that we need to be very cautious about.
It's Dr. New. Maybe I can just add a couple points to what Dr. Tam said. I think we have to look at the opportunity cost and be sort of effective and efficient. It's not strictly what I would call a laboratory exercise, testing every single sample. We can always do that, but then you might, sort of be looking for, maybe a sort of not in the most economical and effective, efficient manner. So as Dr. Tam mentioned, it's, doing it maybe on a sampling basis in terms of samples that come into the laboratories in the provinces, territories. It's also focusing with the public health and the epidemiological side. If there are certain events, cases like a super spreader event, then certainly that would, I think, point provincial officials to do maybe a more targeted testing of the samples involved with that maybe outbreak. For certain, especially if there are cases associated with incoming travelers to Canada, that would be another priority to look at in terms of doing the sequencing, looking for the variants. And then, of course, we're now looking in terms of potential impacts in terms of vaccines. So any of the cases that might be associated with individuals having received a vaccine dose, I think would be something else we'd be looking at in terms of seeing if there are variants around, if there's any impact in terms of the vaccine effectiveness. Thanks.
Thank you. Merci. We will take two final questions. Nous allons prendre deux dernières questions. Opérateur, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Abigail Bimam de Global News. Please go ahead. À vous la parole.
Thanks for taking my question. I'm looking at the issue of so-called vaccine chasers, people looking for leftover vaccines at the end of the day. I'm wondering if nationally we're tracking what percentage of vaccines is usually left over at the end of the day, and if there are guidelines specifically for who those vaccines left over daily should go to.
So it's Theresa Tam. I could take a first try at answering your question. So I think with the actual implementation of vaccine programs is up to the provincial and local authorities. And of course, I think that if there are any leftovers, nobody wants to waste them. So any way in which people can get them into people's arms is really critical. And I think it depends on the setup and the situation where that clinic is. So I think that has to be looked at. I don't think we do not track every single bit of leftover vaccine or where they go to. That would be up to the local authorities. What we do try and share as best practices and making sure that provinces can share how they reduce any kind of wastage. And as far as I have been informed, provinces have done very well in terms of not wasting, any of their doses. So, yeah, and I think of course, as best as possible, go to the groups already identified as priority groups at higher risk of illness, serious illness, or at risk of transmitting those with highest risk of illness as well.
Yeah, it's Dr. New. I just add that there was, as you know, a technical media briefing, and Health Canada has now officially approved in terms of the product monograph that at least for the Pfizer vaccine, they're now officially 6 doses in a vial as opposed to 5 doses. So I think the real live issue right now is to ensure with our provinces and territories, our partners, that you can reliably and consistently get the 6 doses out of the vial. And the information that the Pfizer has submitted, Health Canada is confident that with good technique and also with the right kind of syringes, what we call the low dead volume syringes, that you can reliably and consistently get the 6 doses out of a vial. And so we're supporting the provinces and territories with webinars to make sure that we reinforce what good techniques are in terms of vaccinators drawing the doses out of the vial. And of course, one of the terms and conditions also put on the Pfizer company is to work in terms of continuing education, working with our procurement folks to make sure also that that they're supported, and that also that we can get the low dead volume syringes, make sure that the vaccinators in the provinces and territories have them to use for their vaccination with the Pfizer vaccine. Thank you.
Dr. Tam, I heard you talk about how your role involves providing best practices or sharing best practices with the provinces. I'm wondering if, as the vaccine rollout increases or as the number of doses increases, are there best practices being suggested to the provinces for any leftover doses at the end of the day, and where non-priority staff in some of these settings would fall in that case?
Yeah, so as everyone probably knows, there is a National Operations Center for the implementation of vaccine programs under Major General Danny Fortin. We also have public health networks, which includes the Canadian Immunization Committee, that is the federal, provincial, territorial construct, and they are sharing these kind of information all the time. And so they are constantly sharing best practices. And as we move from, right now we don't have that many doses of vaccine to be administered. The best practices are also moving on to a point where we have many more doses available, and then how are those clinics carried out and how to minimize any kind of wastage is also being discussed as well. So those are the kind of governance tables that help share best practices. We also communicate with healthcare professionals organizations, and as Dr. New said, some of these training programs to make sure that they're not, minimizing any sort of wastage. There are other strategies too. I think that we learn from other countries where the simpler the set of instructions are in rolling out these programs, such as age-based, starting with the seniors and telling the population that, right now is this age group, is a much easier message to communicate, and then more people can show up at the end of the day as well if there's enough vaccines in a particular location. So I think all of these techniques will be utilized.
Merci. Thank you. Last question. Dernière question.
Thank you. Merci. The last question is from La dernière question est de Rachel Haynes from CTV News. À vous la parole. Please go ahead.
Hi, thank you. My first question is for Minister Qualtrough, just as a follow-up to what a number of my colleagues have been asking as well about these CERB repayments. And just a follow-up to Karina when she was talking about how you had said in December that you wouldn't be, or you would not be forgiving this for people who had taken this on their net income. But have there been people who have repaid that money already based off of the letter that had been sent? And at what point is the CRA going to repay them back for this?
Really important question. Thank you. Yes, absolutely. If Canadians, based on getting the letter, took the initiative and made their repayments because they considered that they were no longer eligible because they had used their gross income, we will absolutely be repaying those payments to Canadians as soon as possible. So again, it's a case-by-case basis. We have to make sure they meet all the other eligibility criteria. But if they do, we will be repaying their repayments, which sounds a bit odd, but that's exactly what effectively will be done as soon as we possibly can. For those Canadians who took the initiative to try and make their tax slips as accurate as possible, we will work with them. We will be reaching out to them, or they can reach out to us and help them settle and balance their accounts.
Thank you. And my next question goes to Dr. Tam, just about this conversation that we've been having about the variants. And you had said in response to one of my colleagues' questions that if public health measures are lifted too quickly, that there could be a resurgence due to the presence of variants. And I'm just wondering if you can tell us a little bit more about what impact you see variants having on transmission going forward. Do you think we're going to get to a point where the majority of cases that we see are from these variants?
Yeah, so right now we are detecting particularly the B117 variant, as we just reported. And 80 countries in the world have this variant, including our neighbors in the United States. And the variant's detected in many areas of Ontario, but also other provinces. This particular variant, I think, has definitely a chance to be the one that's replacing other variants. It's demonstrated an increased ability to transmit. So I think more and more evidence shows that this variant transmits more readily. How much more transmissible? I've seen different estimates from different countries, different locations, but the latest estimate is about 35 to 45% more transmissible. So as you can imagine, it's actually quite difficult already to slow down transmission with previously circulating viruses. And you add a virus then that is more transmissible, that just makes it much more difficult to get under control. So I think if public health measures are cautiously relaxed, the moment you see increase in cases and the variant is detected, those public health measures have to be rapidly reinstated depending on the findings. So I think one is that it's just going to be more difficult to control once the acceleration occurs. So you got to stop these, pull on the brakes early if that is the case. The other, of course, is that we do not know the impact of vaccines on transmission at the moment. I do believe we will get some of that information. So we don't know anything about herd immunity at this point, but a variant that's more transmissible, even if the vaccines have impact on herd immunity, it may mean that more proportion of the population have to be vaccinated in order for that to be achieved. So it does have many implications, which is why right now we have to be very cautious. And as local and provincial jurisdictions begin to look at the data within their jurisdiction and cautiously open up, that has to be done very thoughtfully, very slowly, and to see what the impacts are. Does that answer your question?
I think that will be a yes. So thank you everyone for joining us today. Merci à tous de nous avoir rejoints aujourd'hui. Ceci met fin à la conférence de presse. This puts an end to today's press conference. Thank you.